Hello everyone, my name is Osama Kamal. I recently passed my Step 1 exam. During my Step 1 preparation, I felt the need for a system where not only the mechanism of action and applications of drugs are discussed, but also there is a focus on adverse effects of the drugs and the background concepts behind them as well. So in this short series, I'm going to discuss all the drugs included in your Step 1 exam, but I'm going to focus on their adverse effects, mainly how these adverse effects come into place, how these adverse effects happen. So we're going to start today by discussing calcium channel blockers. Now you may know that calcium channel blockers are used as antihypertensives, anti-anginals, and anti-arrhythmic drugs, but we're going to focus today on their adverse effects. So let's start. Now, there are two types of calcium channel blockers, dihydropyridines and non-dihydropyridines. Dihydropyridines act on vascular smooth muscles more than cardiac smooth muscle. Their names are derived from the class of the drug. May, their name carries dipine, which is included in the name of the drug. So amlodipine, clebodipine, and nifedipine. Non-dihydropyridines, on the other hand, are also sometimes called cardioselective CCBs. They act on cardiac smooth muscle more than the vascular smooth muscle, and they include only two drugs, verapamil and diltiazem. Now, a little on their uses. Dipines are mainly used in hypertension, angina, and Raynaud phenomena. Now, you may notice here that the main application of the CCBs is in the cardiovascular system, but because their main mechanism of action is via the arteries and smooth muscle. Now, Raynaud phenomena is a phenomena, I'll tell you shortly, that occurs in the limbs because of peripheral vasoconstriction in response to extreme environment and extreme stimuli like cold or stressful environment. Now you're going to notice here that nifedipine cannot be used in the hypertension, angina, and Raynaud phenomenon treatment, and that is because its root is and its mechanism is something that prevents its application. Nifedipine is an immediate release drug, and because it is released immediately into the bloodstream, it has the ability to cause abrupt changes in blood pressure. It can cause a rapid decrease in blood pressure that can trigger life-threatening severe reflex tachycardia. That is why it is not safe to use in the treatment of hypertension or angina or Raynaud phenomena. Nimodipine is used in the treatment of subarachnoid hemorrhage because it is more lipophilic than other uh, calcium channel blockers. And because it is more lipophilic, it has the more ability to cross the blood-brain barrier. That is a barrier that allows lipophilic drugs to cross more freely. Nicardipine and clevidipine are used in hypertensive urgency or emergency. That is because they are given IV and they have a rapid onset. But in contrast to nifedipine, they have a short time period, short half life. And because they have a short half life, they can only cause modest reflex tachycardia. That is their plus point. That is why they are used in hypertensive urgency or emergency in acute settings. Non-dipines, the cardioselective CCBs, are also used in hypertension and angina, and they are also used in atrial fibrillation or flutter, and that stems from the fact that CCBs do not only act on cardiovascular smooth muscle, but they also act on the cardiac conduction system of heart, and that is why they are used as a rate control agent in atrial fibrillation or atrial flutter. Now we are going to focus on the adverse effects. The first adverse effect that is common to all CCBs is the gingival hyperplasia. Now, gingival hyperplasia is associated with long-term use of CCBs. You are not going to see gingival hyperplasia if a person has just started taking their CCB. So, gingival hyperplasia, uh, you know, acts via the main mechanism of CCBs. CCBs cause arterial vasodilation that causes an increased blood flow through gums. Now, gums interpret this increased blood flow as an increase in opportunity to grow like all body tissues. So they interpret it as a growth stimulus, and they increase their own growth factors and collagen. That is why the gums will grow more, and that will cause gingival hyperplasia. After that, the depends. Now you're going to see here that the depends, the adverse effects of depends are mainly focused on the peripheral systems. Like if you have limbs, you have peripheral edema. If you have face, you have flushing. If you have head, you have dizziness. So now all these are peripheral, because I'm saying peripheral to clarify it from the hard side. So how does depends cause these side effects? They cause these side effects by arterial vasodilation, the main mechanism of action of CCBs. The verapamil and diltiazem, on the other hand, cause cardiac depression and AV block because they're cardiac selective. They act on heart. Now, I said in the previous slide that verapamil and diltiazem are used in the atrial fibrillation and atrial flutter to as rate control agents. If there is a toxicity of these drugs, or a person has taken more than the therapeutic dosage, then these can cause AV block. They can cause severe decrease in the conduction velocity, and hereby thence increasing the PR interval more than uh, expected. Now, verapamil also causes hyperprolactinemia, and this adverse effect confuses many students. There is a research that calls that verapamil causes this hyperprolactinemia by inhibiting some calcium channels in the tuberoinfundibular pathway. Tuberoinfundibular pathway is associated with the release of dopamine from hypothalamus to pituitary, and it is involved in the inhibition of the prolactin release from the pituitary gland. Now, because uh, verapamil inhibits the calcium channels in this pathway, the prolactin release is disinhibited, meaning that prolactin will be released from the pituitary, and it will cause hyperprolactinemia. Symptoms like galactorrhea and other things, decrease in libido in men, and etc. And the verapamil and diltiazem, they cause constipation. Now, constipation is something that is common to many drugs. Verapamil and diltiazem cause constipation by blocking the promotyl calcium channels in the colon. Now, this is a proposed mechanism. There is no consensus, and there is no many koi a very large RCT to prove that this point, but this is a proposed mechanism, that they block the calcium channels in colon, that leads to decreased large gut motility. So the adverse effects are complete here. Thank you very much for watching. Now, this is my first video. You may have noted me stuttering with the video, but I'm going to improve myself with every video, with every drug. Now I ask you to please subscribe my channel and comment, if any, uh, comment the type of drug you like that I discuss first, that you want me to discuss first. I will include them first in my series. Otherwise, I'm going to just take a drug and make a video on it. So thank you very much. Thank you very much for watching.